Hey, welcome back to MobilityWOD. We're gonna take on what to do should you find yourself in the dreaded situation of the hot spot. Let's define that. What do I mean? Hot spot is any overuse, point tender, went for a run, did too many muscle ups, elbow hurts, back thing that ends up being acute. It's in a response, I twist my ankle, something happens, acute. Now, if you're injured, and that means you can't like weight bear through your foot, or you have night sweats, dizziness, fever, vomiting, nausea, unaccounted for weight loss or weight gain, problems when your bladder or bowel function, when you cough, sneeze, or swallow, go see the doctor, right? If you cannot do your sport, then go see your doctor. If you cannot occupy your role in your doctor in society, can't pick up my kids, my arm's gonna fall off, go see your doctor. The rest of it falls into what we've called this incident category. You're not injured, you have had an incident. Your body's telling you of a mechanical issue. I went and paddled 200 miles and now I got a little sore spot here. What we want to do is give you a first line of defense to address this hot spot. Now, we've done plenty of soft tissue work around it, but we want to get a little bit more into the language of perfusion, perfusion, and desensitization. We want to desensitize. And what we're seeing on the two of these things is that when I have had some kind of acute trauma injury / overuse problem, I've just overworked the tissues or have them on in a bad vector, some little angle, right? What I want to make sure is that one, I'm addressing any localized swelling. How do we do that? We love compression, we love elevation, we love non-painful movement, we love Mark Pro, we love Compex, Red Dot, all of those things fit into that category. But I also want to think about what are the ways where I can improve blood flow to this area besides decongesting. Now, any movement, any muscle contraction, any movement is going to take the garbage out and bring the groceries back in. We know this, we've talked about it ad infinitum. But there are a couple other techniques that we know make a big difference around this, and we want you to think, hey, something's hurting, can I desensitize it so it doesn't hurt as much, right? Just with a little bit of, with some easy techniques. And two, can I improve the rate of blood flow to that area so I can heal a little bit faster, I can get on that curve. Now, let's be honest, you cannot heal faster than a body can heal. It takes time for the tissue to be injured, to put out the chemical signalers, to bring in the stem cells, to bring in the macrophages, to bring in the insulin growth factors. All of those things happen in a stepwise motion. However, we see that people are often sort of not optimizing the way. So yes, you have 500 horsepower in your car, Dave, but you're only using 300 horsepower, and I want you to use all 5, maybe 501 hidden there, right? So here's the deal. What I want to show you is a couple simple techniques. So what we've got here is what I think is a good perfusion package. So I've got a scraping tool, and we've talked about scraping before. I've got a little slippery foam. This is made by Field Foam. We like it because it's got silver on it, it's good for the pH, and it's not greasy, but whatever foam or lotion you've got. This can be a spatula. I've got a voodoo band, what we're going to use for some blood flow restriction, and I've got a Mark Pro here. Now, the first thing I want you to understand is we want you to take a crack at that little area. So if I've got a little point tender area, let's say that I went for a run and I've got a little hot patellar ligament here, right inside jumper's knee. What I can do is take this tool and do a little scraping. So what ends up happening is that these tissues now, because they're irritated, aren't getting a lot of blood flow, they're a little bit locally congested, and one of the things I can do, holding this at just a 90-degree angle, I can get a little scrape here, I can bend my knee and scrape, I can kind of pull past it, right? I can scrape in both directions. The idea here though, is that I can just give myself a little bit of input. Now the idea here is to get a dose and a response. So typically we say 30 seconds to a minute max, Don't hammer the crap out of the injured tissue. Get a little response. Just by freeing up the local fascia, by addressing this local tissue health, I will get a little bit more perfusion in that area, and that may be enough to help jumpstart and get me over. I can work, of course, upstream and downstream of that to feed some slack to that, but don't be afraid to actually get in there, put it on a little bend, get in there and play with that thing for 30 seconds to a minute and just give it a little bit of love. And if it feels not too sore, not too painful, you didn't overdo it, give it another dose later on. If it's point tender and you've scraped the crap out of it and you can't do it for 2 days, you did too much. But this perfusion scraping should be your first go-to. Hey, a little hot on the elbow, go ahead and take that. And if you don't have lotion, go ahead and dry scrape yourself. You'll see though that you can, one, change the local sensitivity of that, and just by freeing that up and giving a little bit of input with the scraper, you'll see that oftentimes that will resolve your pain symptoms while we're improving the sort of health and well-being of the ecosystem. Okay, so that's number one. Number two, one of our favorite techniques for addressing this is we love, I've got an area that's a little bit junky. I can do this combination of movement and blood flow restriction. So BFR is pretty safe. The rules of thumb are, if it feels sketchy, it's sketchy. I should be able to wrap high up around the joint. And the typical rules for arterial blood flow are you can compress down to 80%, which is massive amounts of compression. There are very sophisticated, really accurate models for this. But our idea is we're going to put a little clamp down, not so much that we get numb and tingly, but I'm going to get a little clamp down and I'm going to do some work. And one of the ways that we love this is that, for example, if I had a little hot runner's knee here, I could throw on the pads. So I'm just going to throw a quick setup here on my quadriceps. Right, just that alone. I'm going to dial this up, and I can obviously just get a lot of good quality. Let's turn this guy off. I'm just turning it on to low frequency here, and I'm going to get some pumping. Must click off, change intensity. There we go, let's click off. Low intensity, there we go. Now, I'm starting to get some muscle contraction here. I can push it out and do the calf as well, but what I'm doing here is I'm making the leg work. So if I couldn't bend the leg because it was injured or really painful, one of the things that I could do was with the leg straight, I could just pump. But since I'm going to be pumping anyway, an easy thing to do is to take a good bite of the high hip or top of the shoulder and go ahead and give yourself some big beefy wraps right around here so that you're like, ooh, that is sporty. Not so much that I feel like I'm freaking out, but your leg can handle a pretty good dose here. We should be able to have a load that we can handle for 3 to 5 minutes. That's pretty tight now. And now I'm going to just pump. And what's going to happen is that I am starting to force the vasculature to do a lot of work because I've clamped on up here. So right now I'm starting to feel a little bit of a different kind of burn in my quadriceps. So I can rock this thing out. I could, if I didn't have one of these, I could squat. I could do easy movements. I could just flex my quad. I could stay in pain-free ranges because remember, I just irritated my knee and I'm like, I don't think I want to squat. I want to stay in pain-free ranges. I want to stay in any motion that I can do that doesn't hurt. But right now, with the leg sort of up, what's starting to happen is I am getting what we call an intense burn. It feels like lactic acid is building up, and guess what's happening, Dave? No. Lactic acid is building up. And so what's happening is that the musculature, the vasculature, is starting to have to super compensate. So now we're about a minute in. I'll go 3 minutes on this. And what's feeling like is, whew, I feel like I'm doing some hard, heavy sets of 20 squats. The musculature is working really hard and starting to freak out because it's working with occluded blood flow. And what's going to happen now is that there's a whole bunch of very exciting and very interesting downstream effects. Take a look at all of the BFR research. Look at what's happening in the uses of it. Katsu has been doing this in Japan for positive workouts forever. BFR is post-surgical results with a lot of the teams we work with, a lot of the doctors we use it post-surgery. But we're saying that you don't have to be very sophisticated. With a voodoo band, you can approximate even 50 to 70% 100% effectiveness. And right now, like I'm like, ooh, it feels like I'm losing the ability to get a good active contraction because I'm working hard. So now I'll hit this 3 to 5 minute mark, and then here's the magic. We pop this off, and we get this immediate large rebound. In fact, I don't know if you can tell, but one of the things that's happening is that I'm getting a much stronger contraction. So now with the voodoo band popped off, I'm getting a crashing through of blood. The arterioles have worked really hard, and basically I'm forcing blood to come back in. Compared to my other leg, you can see that this leg is actually pink now. Can you see that?
Yeah.
Compared to the other leg. And what's happened is I've just gotten massive reperfusion in tissues that may be slightly difficult to be perfused. Why? Because they're swollen, because they're injured, right? Because they're painful and I can't move them more, or I just can't get this sort of low-level movement. If you've ever seen someone with knee surgery who gets on a bike and just spins, one of the magic of that is not just restoring range of motion, but just getting muscle contraction to get the tissues to be able to move through full range. So now popping this off, blood comes crashing back in, and we've created an environment where we're going to see improvement in the healing process. I can't expedite the healing process, I can only facilitate that healing process. So now, since I'm already pumping and trying to remove the congestion, adding on the voodoo band and repeating this a couple times, one time, however much time I have, let this rock. So for if I did 5 minutes on, do 5 minutes off, hit it once or twice, that's good enough. You've already done a lot of very interesting signaling at the muscle level, at the tissue level, to cause super compensation in these tissues. So it's an easy way to sort of get a boost in things like growth hormone, and all of the angiogenesis, or the mechanisms that rebuild capillary beds and things like that. So easy way to just basically force flush, drano flush those small little vasculatures which may be a little bit clogged or not working well. So here's the idea. When I have a hot spot, my idea is, let's get you out of pain. Can I change that local area with a little soft tissue work? 2, can I do a little scraping around that, right, with the technique, and that's obviously 1 and 2 together. And then 3, this little blood flow restriction for a simple, common hot spot. Very, very, very powerful tool. And again, you don't even have to have a muscle contraction device, right, a muscle stim. You can just use a voodoo band and get a little movement. 3 to 5 minutes, respect your numbness and tingling. If it feels sketchy, it's sketchy, but what the things you're doing now is basically giving yourself permission to heal at max speed. See you guys tomorrow.